دكتور مرتضى المسافر, urologist, professor urologist at University of Basra College of Medicine. We would like you to give us a mini brief lecture about how to approach a patient with urinary calculi and how to manage a patient with acute pyelonephritis.
Okay, thank you very much. We start with how would you approach a patient with urinary calculi, and the most important thing is history taking. The most important symptoms you should ask is pain, and we have two types of pain. We have a dull ache and a ureteric colic. Ureteric colic is specified for a stone descending down into the ureter and is defined as a pain from loin to the groin. The other thing is that the patient might present with fever and rigor or urinary symptoms like dysuria, frequency, urgency, with or without hematuria. And in addition to that, some patients might have no symptoms at all, and what we call it a silent presentation. After that, you have to ask the patient about his past history, and it includes the past medical and surgical history, and we concentrate in the past surgical history on previous surgeries, because as we know, we have a significant proportion of patients that have a recurrent stones, and we call them as stone formers, and some of them they considered as having malignant stone disease because of recurrence of the stones. In addition to that, we have to ask about any previous surgeries like ileal resection or bariatric surgery, and we should concentrate nowadays on bariatric surgeries because this is an evolving surgeries nowadays, and a lot of patients doing these surgeries, and this will predispose to a stone disease also. Also, we have to, after that, we have to have the vital signs and the general examination of the patient. And in general examination, you should concentrate on the general look of the patient, whether he has some signs of uremia like earthy color, or uremic frost at the face, or at the hands we have a half and half nails, and in addition to that you might see a hyperventilation due to acidotic breathing and uremic fetor. The patient might be in coma due to uremic coma, or might have an hysterexis and irritability. These are important signs. Then you have to search for pallor, because those patients due to erythropoietin deficiency or insignificant, as we know that the erythropoietin stimulates the production of red blood cells. This might be defective and the patient have anemia. In addition to that, you have to search for the abdominal examination. You should do, vital signs for the temperature. The patient might have a high-grade fever and rigor, or the vital signs in like pulse rate, blood pressure, and so on. After that, you have to do an abdominal examination, and the most important things in the abdominal examination include palpation of the kidneys and urinary bladder, in addition to examination of genitalia and renal angle tenderness. These are very important things in the history and examination. The next part of this lecture is how would you approach a patient with acute pyelonephritis. First of all, you are as a resident, and as a resident at the emergency room, you should have a high index of suspicion. For example, if a patient presented to you with loin pain or ureteric colic plus fever and rigor, you should have a high index of suspicion as this patient having an acute pyelonephritis. and acute pyelonephritis is one of the urological emergencies. You have to inform the urology permanent on call, and you have to start the searching for taking a history and also examination, and you should send the patient for investigations in the form of urine analysis, searching for pus cells, and also for renal function tests. You can take a blood sample and urine sample for culture and sensitivity. These are very important points. After that, you have to admit the patient to the hospital and starting a broad spectrum antibiotic in addition to the IV fluid to correct the hydration status of the patient. Patient might be dehydrated because of high-grade fever. Patient might have vomiting and he is dehydrated. Then you have to give the patient an IV fluid. And after that, you have to search for and you follow the patient, and then whether he is improving or not. After that, you have to do imaging in the form of an ultrasonography. You might need a CT, computerized tomography also. Then you decide for the whether this patient needs intervention or not. If he has an obstructive uropathy, the answer is to bypass the obstruction. Otherwise, the patient might not be improved on antibiotic only. Then you have to admit the patient to the theater and you do a ureteroscopy and you put a stent in the form of double J stent. If the patient is not amenable for surgery with comorbidities, you can do diversion in the form of percutaneous nephrostomy. And also the patient should be kept on antibiotic, and you have to follow the patient and you follow the vital signs only, also and the urine output. Thank you very much.
Thank you, Doctor, for this nice, brief and informative summary. We would like our colleagues and young doctors to get and benefit from it and apply it in their future life.